What type of doctor should you see for your knee injury? I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist. I provide education, information, and commentary on all sorts of sports and exercise injuries, injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform your best. As orthopedic surgeons, especially working in sports medicine, we see athletes and active people all the time with bone and joint injuries. It could be the shoulder, the elbow, the wrist and hand, the hip, the lower back, the knee, foot and ankle, whatever your injury is. But do you need to start with an orthopedic surgeon, or could you go to your primary care doctor? It's a valid question, and in this Ask Dr. Geier video, I'm going to discuss that exact scenario and the pros and cons either way to help you make a decision on maybe who you see for your injury. Bridget asks, a few days ago, as I was walking in the street, my left leg locked on me twice. At that time, I experienced excruciating pain in the knee. Since then, my leg has locked a few times while walking, and the pain is constant at the top of my knee when I try to straighten it out. When it is bent, I don't have pain. I don't have swelling, just pain and locking. I also feel off balance. Do you think that I should see my GP, general practitioner, or internist first instead of an orthopedic surgeon? Or should I just go to the surgeon for evaluation? Okay, that is a terrific question, and I'll start by saying there is not an absolute right answer. I'm not going to be biased and say, oh, you should definitely go straight to the orthopedic surgeon first. First of all, your insurance may not even allow that. You may have an insurance plan where you have to see your primary care doctor. If it's a kid, it may be a pediatrician or your family medicine doctor or your internist, but you may need to see your primary care doctor before you go see the orthopedic surgeon. If you call your insurance company, you can find that out. If you called the orthopedic surgeon's office and told them, hey, I've got this type of insurance, you might be able to find that out as well. Also, there are some orthopedic surgery practices that do want a referral first. Not always. In fact, I don't know that I've ever worked at one where you couldn't just call and make an appointment with an orthopedic surgeon, but that could be possible as well. If you're not sure, call the orthopedic surgeon's office and check. But sometimes it can be a good idea to see your normal doctor, your family doctor. You have a relationship with that doctor, he or she knows you, they know all your medical problems and everything else, so you're going to feel comfortable in there. And yes, they can evaluate your injury. No, they don't a lot of times have, most of the time honestly, the experience that orthopedic surgeons have with musculoskeletal injuries or bone and joint injuries, but they can do the basics. They can ask you questions about it and do an exam, and they can get x-rays. Most of the time, some physicians don't have x-ray in their office, and they may make you go to another facility, but they can certainly do that. In theory, they could order MRIs. That's sort of a debatable topic about whether or not you should get an MRI from a primary care doctor. And there's arguments for and against. That's beyond the scope of this. But you can absolutely go to your primary care doctor. And if you find out, hey, it's not a big deal, that doctor, your doctor can write for physical therapy, or maybe get you a brace, or have you try anti-inflammatories, things like that. And you may never need to see an orthopedic surgeon. So I definitely get that. Plus, I know a lot of people really don't want to go to an orthopedic surgeon. Maybe it's the word surgeon in the title, but you're afraid that we're going to tell you you need surgery. We're going to tell you, hey, you've got to do it, or we've got to shut you down from your sport or exercise. But the vast majority of the time, we don't need to shut you down. Occasionally, yes, these injuries do need surgery, but it can be a good idea sometimes to see an orthopedic surgeon to get back to what you want to do. A situation like a knee that's locking in place very likely could have a surgical component. Locking essentially means the knee is getting stuck in a certain position as you go through a range of motion, and it keeps you from doing what you want to do. It may be a loose body, a loose piece of cartilage. It may be a meniscus tear that's locking and catching in there, but that potentially is surgical. So I don't think anybody would fault you for skipping the primary care doctor and going straight to the orthopedic surgeon either. Again, there's not a right answer. I think that if it's an injury that's really limiting you from being able to play your sport or do your exercise or do your just basic daily activities, there's not that much harm in seeing a sports medicine doctor, seeing an orthopedic surgeon first, especially because seeing one doctor instead of two may save you a little bit of money. But again, I'll tell you, there's a lot of good reasons to see your primary care doctor first. Okay, have you suffered a bone and joint injury, and what type of doctor did you see? Did you go see your general doctor, your family doctor, or did you go see an orthopedic surgeon right away? And what was the injury, and how did it go seeing that particular doctor? I would love to hear your experience and your story and how it went. So below this video, share your experience, share your thoughts. I'd love to read it, and I know people all over the world would get value out of that as well. If you like videos like this and you want more information and education on sports and exercise injuries and injury treatments and injury prevention, subscribe to my YouTube channel. There's a subscribe button in the upper right corner of the page. Click on it. I record a couple of these videos every week and they'll get delivered directly to you. If you know somebody dealing with an injury and that person doesn't know who they should see, please share this video with them. I hope it's very helpful to as many people as possible. Thank you so much for watching, and I look forward to seeing you right here next time.